Hello.
Today, I wanted to talk about failure to diagnose cancer. These are cases that we've been seeing in our office recently. And I just kind of wanted to go over some of the pitfalls, some of the things that would allow these cases to succeed. And then one of the main cases on this type of failure to diagnose, which is Hertzkovitz.
Yeah, let's do it.
Yep. So the first thing is, can you tell us a little bit about some of the cases that we've gotten in recently? Maybe not the specifics, but just kind of generally what those cases are about.
Yeah, so I see this a lot where someone has symptoms that would raise concerns for cancer, a tumor, a lesion of some kind that doesn't look right, that should be looked into, but for some reason it gets missed. So there's very many different types of cancer. We've seen this happen with a nodule on the lung that, they failed to scan early enough to catch the cancer as it grew, and then it grew, twice the size by the time they caught it, that kind of thing. And then by the time they catch it, it's at a stage where it's much more difficult to treat, right? Cancer can spread very quickly. And so it can go from stage 1 to 2 to 3 to even 4 very quickly. And so timing in these cases is really crucial. And so we see cases a lot where even a matter of months makes a huge difference.
Yeah, and a lot of times these cases, like the doctors, there's certain risk factors of the patient when they come in. And if there's, maybe two or three risk factors put together, then the doctor should either do either some testing of some kind or some imaging of some kind or maybe a biopsy. And they don't end up doing that. They just say, well, come back and we'll take a look at it in 2 months. And,
Right.
maybe based on either certain guidelines or national guidelines or just the common practice in the area, the doctor should have been more aggressive about trying to figure out whether or not cancer was there.
Yeah, absolutely. And there are very specific guidelines for different types of cancer and how to monitor that. Certain types of scans every 3 to 6 months for the first 2 years, those kinds of very specific guidelines that doctors are supposed to follow. So when those aren't followed, it's a big issue.
Yeah, and that's kind of just the first hurdle, really, is proving that there was a deviation from the standard of care.